as his because it says his email address doesn't match any panelists. So I wonder if we put Jason's name in the panelist list as @utoledo.edu. Do you know if that was the case? The question was directed towards Stephanie.
Oh, I'm sorry. I don't recall.
Sorry about that. Yeah, okay. All right, I'll have him try something different.
Stephanie, do you by chance have Gwen's phone number?
Let me look. I think I might have it.
I'm concerned if she's not.
Okay, I just spoke with Celia. She signed in as an attendee, but then that doesn't show her on the screen, correct?
That is correct. Stephanie would have to promote her to presenter.
Okay, I went ahead. She received Stephanie's email, so she's gonna try that. So she's gonna log off and try logging back in using the panelist link.
Okay, good old technology. So we'll get started in a moment. Everyone, sorry for the challenges we're having here. I'm going to step away real quick.
Okay, Stephanie, it wouldn't allow her on as the panelist link, so she's gonna go back and use the attendee link, and then maybe you can then allow her permission to be seen, I guess.
Okay. Yes, I can do that. Brent?
Yeah.
So did Jason log back in?
Jason. Oh, I don't know. I sent him the email to try a different, try the other email address.
Okay. Yeah, it looks like he is on as a attendee.
Okay. Yeah, I don't know what keeps happening with that.
Wow. Okay.
So far, not so good for the event.
Okay, I'm on the line right now with Gwen, trying to get her situated. So we're going to get started in the next 2 or 3 minutes. We're trying to make sure that all of our panel members are present. So thank you everyone for chiming in, and please be patient with us. And we'll be getting started in a few minutes. Okay. Okay.
Okay, are we missing anybody that needs to be a panelist? Gerard, does he need to be a panelist?
Yes, he should be. He should be on. Jerry Natal,
Yep.
you on, Jerry?
Sorry. Sorry if I said.
Hello. Can you hear me?
Yep, we can. Okay, so right now I'm on the phone with Gwen Gregory trying to get her. She's trying to get logged in right now.
She's actually showing up. Only one we're missing is Celia, and she is listed as an attendee. She signed in there.
Okay. So Gwen said, Gwen, we can see Gwen, but Gwen, can you speak or unmute yourself? No. No, we still cannot hear you. Why don't I do?
So the microphone on her computer might be muted because she's connected to audio.
You're connected to audio according to Brent, so maybe your microphone.
At my microphone on my computer, and it's not muted. It's actually up to 100, and I can hear everyone. I can even hear myself.
Well, then tell you what, we're going to do this the old-fashioned way, and so I guess in the interest of time, if you can,
Uh-huh.
there you go. There you,
Okay, can you hear me now?
there you go.
Yep.
Oh, good. Okay,
Okay,
great.
I say we go ahead and get started. Do we
Yes,
have any-
yes.
So is Celia able to log in yet? Stephanie?
Oh, sorry, I was on mute. She is an attendee, but not a panelist.
Okay, but she's on, but she can unmute herself. She can be unmuted, correct?
Yes, we can unmute her.
Okay,
Correct.
okay, great. I say then we go ahead and get started.
Who do we need to unmute? I'm sorry.
Celia?
Um, does anybody else see her name? I don't see it.
I don't either.
She was I just saw, but nope, she's out.
Okay, we'll get started. And Stephanie, can you and Brent maybe start working behind the scenes to see if you can get her on while we get started?
Yes,
And just a request to panelists, can we make sure that we're muted if we're not speaking?
Certainly.
Can you unmute Kenny Brown as well, Stephanie or Brent?
Yep, he's unmuted.
Okay, good. Jerry Natal, okay, I think we're ready to go. We're about 15 minutes late, so do apologize for that to everyone who took the time to join us this evening. So our apologies for that, but this is technology. This is our fourth one, and you think that we'd have the technology worked out, but it's technology, and we'll get better at it. So I do apologize for that. So good evening. My name is William McKether, and I serve as the Vice President for Diversity and Inclusion at the University of Toledo. And so this evening is really my honor to once again host Dialogues on Diversity tonight in collaboration again with Brothers on the Rise Mentoring Group at the University of Toledo. So since January, at least, the country and of course, state of Ohio, the University of Toledo has been ravaged with COVID-19. In January, we didn't know much about it. We were still trying to figure it out. Certainly 3 months later, by March, the University of Toledo went totally remote. As students came back from spring break, they were instructed to pack up and go home. That then meant the university itself had to begin working remotely and learning how to work remote. So thereafter, the entire state of Ohio shut down. Everybody worked from home, and that was March. So here we are now in July, and we've learned a little bit more about COVID-19. But we know now that thousands, millions of people have contracted the virus. Many have died, but yet many have also survived. So while there are some unknowns about COVID-19 as we continue to figure it out, one thing that we do know is that the impact of COVID-19 has been felt disproportionately on people of color, in particular Hispanic and African American populations, which is really the topic of this evening's Dialogues on Diversity. So again, I welcome you to tonight's event. And at this point, I'm going to ask my good friend and colleague and Brothers on the Rise member, Jerry Natal, to provide some words of welcome as well. Jerry.
Yes, thank you, Dr. McKether. And my name is Jerry Natal. I'm with the University Libraries. And I'm going to try to keep this brief because we are a little bit behind. But it's true that people of color disproportionately shouldering the burden of a lot of things. I did some research on health disparities before this meeting. So just a few things that I wanted to point out in general. That 33% of low-wage jobs provide paid sick leave compared to 81% of high-wage jobs. So who is disproportionately inhabiting those low-wage jobs? If you're a farm worker, you have a higher risk of injury, pesticide poisoning, exposure to antibiotic resistant bacteria, and public school students spend 2/3 less time on playgrounds. If you think about these things and how they add up and how they affect people of color, it shows you pretty clearly that when it comes to something like this pandemic, that they are also going to be shouldering the burden, the majority of the burden for things like, well, that's what we're going to be talking about today. We're going to be talking about how we are disproportionately affected by the COVID. One more thing, if you're interested in some of these statistics, there's a library guide on the University Library's website for health disparities. and you can get a lot of statistics that cover just about any group that you can think of. It's pretty eye-opening to look at some of these statistics here. I'll leave you with one that's sort of related. Move on. But in 2015, it says Hispanic adults were 30% less likely to get a flu shot than non-Hispanic whites. So think about that. Think about access to healthcare, getting vaccinated. We could come up with a vaccine, and it doesn't mean that everybody who needs it is going to get it. So I'm sure that our panelists are going to list a lot more detail. So I'd like to thank them all for volunteering to be here this evening, and I'm looking forward to hearing what you have to say and your expertise. So thank you for being here, and thank you also for all of you that are attending. It's wonderful that you want to learn more about these things and pass the information on, because it's not just about being informed, but it's also about having an impact and passing that information on to others. So thank you.
Great. Thank you so much, Jerry, for those words. And so you've done, I think, a great sort of setup for the wonderful panel that we have for this evening's program. We'll get to that in just one moment. So just real quickly, program overview. Just got a welcome from myself and from Jerry Natal. I'm going to give a quick overview of Brothers on the Rise. We're then going to have Kenny Brown to introduce our moderator. And from there, we'll start with opening comments from the panelists. There'll be a Q&A session, and Dr. Spann, who's our moderator, at the appropriate time will ask people who are on the line to begin entering questions into the chat. But then we'll do the Q&A, provide some campus resources, and then some closing thoughts. So as indicated at the very opening, tonight's event is being co-sponsored with Brothers on the Rise. And I did talk a little bit about Brothers on the Rise a couple of weeks ago, but I can never say enough about Brothers on the Rise as an organization, because again, it started 11 years ago with Black and brown men at the University of Toledo wanting to make a difference in the lives of Hispanic and African American students to help ensure that they had an opportunity to be successful at the University of Toledo. And that's the organization that's co-sponsoring tonight's event. And I think almost many of the panel members, especially the men, are also members of Brothers on the Rise, as well as Jerry and myself. So Brothers on the Rise, that's the organization, again, that's helping to co-sponsor tonight's event. So at this point, I'm going to ask Kenny Brown, if he's not already unmuted, to unmute himself, and he'd please introduce this evening's moderator.
Perfect. Can you all hear me?
Yes, we can.
Perfect. So as Dr. McKether mentioned, my name is Kenny Brown. I work as an advisor for TRIO Student Support Services here at UT. So I'm going to go ahead and get to introducing Dr. Spann. So Dr. Sammy Spann has worked in higher education for over 20 years. Currently, he is an associate vice president and dean of students at the University of Toledo. He oversees the Office of Student Conduct, the University Counseling Center, also Office of Student Advocacy, Office of Student Involvement and Leadership, and Greek Life. Dr. Spann worked closely with several international and domestic student groups on campus, as well as mentoring minority students. He does numerous presentations every year and has traveled extensively over 72 countries around the world. He has attended Harvard Business School, High Potential Leadership Training, Millennium Leadership Institute, and serves as a board member for the UTMC Credit Union, Blue Key Honor Society, and Camp Adventure, to name a few. He holds a PhD in Special Education Curriculum and Instruction from the University of Toledo, an MA in Special Education, Severe Behaviors and Autism from the University of Northern Iowa, and a BA in Infant and Child Development from Fort Valley State University. Dr. Spann's publications appeared on Liberian Studies Journal and are focused on autism and other developmental disabilities. He enjoys spending time with his wife and 2 daughters. Without further ado, a great man, a great mentor, and a great moderator for this tonight's event, Dr. Sammy Spann.
Well, thank you so much, Kenny. You make me sound good, man. I really appreciate it. Good evening, everybody out there. It's good to see all these beautiful brown and black faces and everything in between. I'm excited to moderate this today. Thank you for joining University of Toledo and continuing dialogue on diversity. This is our fourth dialogue. Thank you so much, Dr. McKether and your team, for putting these together. They are good to bring us together so we can have some type of dialogue. As Kenny said, my name is Sammy Spann, and I'm looking forward to moderating this evening's dialogue. I want to start out by talking about our panelists. I'm going to go black out here a little bit because I have to pull this. I only got one screen here, so you can still hear my beautiful voice, just can't see my beautiful face. So I'm going to start out first with Gabrielle Lomelli. Gabrielle is a college admissions professional with more than 19 years of progressive experience. He currently manages the freshman recruitment effort and plays a pivotal role on the enrollment team here at the great University of Toledo. He always carries a smile, and he's not ashamed to have a conversation with anyone who he comes in contact with. The next person I would like to introduce is Mr. Louis Guardiola, Jr. actually. And Mr. Guardiola earned his MSW from Cleveland State University in Cleveland, Ohio in 1998. He joined the social work program at the great University of Toledo as field director in 2014. He currently serves as assistant dean for diversity and inclusion for the College of Health and Human Services. He has over 30 years in the practice of behavioral health care and holds professional license in social work, chemical dependency. His primary research and practice interest includes cross-cultural communication, Latino, Hispanic mental health issues, and macro social work practice. He has an extensive background as a diversity and inclusion trainer in healthcare and academia. The next person I'm not sure is Dr. Cecilia Williamson is with us, but I will do her bio for you as well. Dr. Cecilia Williamson has been engaged in anti-human trafficking work for over 25 years. She has published numerous articles on the subject and has delivered over 200 presentations at various conferences and events. She's founded the first anti-trafficking program in Ohio in 1993 and directly worked with victims in Toledo for several years. She's completed numerous federally funded studies, written several articles, edited, and contributed to 4 different books on sex trafficking, and completed a memoir of her experience as an anti-trafficking advocate. Dr. Williamson in 2015 became the Director of Human Trafficking and Social Justice Institute here at the University of Toledo, and also to further our commission of improving the human condition. Dr. Williamson teaches social work practice and human trafficking courses. Our next panelist will be Jason Wanamaker. Jason Wanamaker is a Toledo native in his 4th and final year of medical school here at the University of Toledo, where he also received his bachelor's in biology. Jason will graduate this spring and plans on beginning his career as an emergency medicine physician. His love for community improvement and helping others is deep-seated, both professionally and personally. He continuously talks about family values, and his passion to be a role model and advocate. I had the privilege of traveling to Haiti with Jason, where he was able to volunteer numerous hours working with children and observing the Haitian healthcare system. Next person I have here will be Gwendolyn Gregory. Gwendolyn received her MBA with a concentration in healthcare leadership and a Master's of Science in Nursing from Spring Arbor University with over 30 years of clinical nursing experience. She received her undergraduate nursing degree from Walden University with a minor in African American history. Previous leadership roles include managing outpatient surgery at UTMC, numerous nursing supervisory positions, serving as the chief nursing officer for the State of Ohio Hospital from 2017 to 19, and currently she serves as the Director of Clinical and Community Wellness at the Lucas County Health Department. Next will be Dr. Brian Dolce. Dr. Dolce is a healthcare provider in Toledo who specializes in cardiovascular disease, internal medicine, He graduated from Wayne State University School of Medicine in 2002. Dr. Dolson is affiliated with ProMedica Northwest Ohio, cardiology consultants. His hospital privileges include ProMedica Toledo Hospital, St. Luke's Hospital, ProMedica Monroe Regional Hospital, Flower Hospital, and H.B. Magruder Memorial Hospital. Our next panelist will be Dr. Brian, sorry about that, I'm pulling up here. Dr. Monica Holliday Goodman. Dr. Monica Holliday Goodman is Associate Dean for Health Science, Student Affairs and Diversity, and Professor of Pharmacy Practice at the University of Toledo College of Pharmacy and Pharmaceutical Sciences. She received a BS in pharmacy and a PhD in pharmaceutical sciences from the former Northwest Louisiana University, presently the University of Louisiana at Monroe. Dr. Holliday Goodman is also a registered pharmacist. Dr. Holliday Goodman teaches and research focus on socio-cultural, behavioral administration aspects of pharmacy practice. Her research passion is the elimination of health disparities and barriers to care for underserved patients. I think that was it. I think Brian Dolson, did I do Brian Dolson? Yes. And those are our panelists. So what we have asked each panelist to do real quickly is to go and at any random order to talk about 2 to 3 minutes about their personal or professional experience as it relates to the impact that COVID-19 had on them. So I would like to open the floor up for our panelists to start the conversation, and we'll, I do ask all the audience to please submit your questions in the chat, as Dr. McKelvey mentioned earlier, but I would like for our panelists to go ahead and talk a little bit about some of their personal and professional experiences with COVID.
Okay, I'll start.
Thank you.
You're welcome. Personally, I've experienced the pain of losing someone very near and very dear to me due to the COVID-19 virus. I have a very close person that died from it, and it took this person very rapidly. So I speak to a lot of people that have doubts regarding the legitimacy of this disease, because I can guarantee them that it is a real fatal disease. There's no conspiracy attached to it. It's just a nightmare for those that have suffered from it. It's a blessing for those that have conquered it, but there are so many people that have not. Professionally, again, I have firsthand experience witnessing and participating firsthand in countless hours of nonstop work at the Toledo Lucas County Health Department. The staff there have been working around the clock, holidays, weekends, phone calls never stop regarding complaints, questions, concerns. We're providing guidance, direction, information to businesses and the community, trying our best to continue to ensure the safety and well-being of the community here in Lucas County. So I don't think a lot of people understand the volume of work and the significance of work that the health department staff are responsible for and are performing on a regular basis, but they need to be recognized. And I wanted to take this opportunity to say to all of them, we are in this together, and they are working nonstop. It doesn't matter if it's the 4th of July. It doesn't matter if it's Sunday. Nonstop work is being done to help the community here in Lucas County.
Thank you so much. Gabe, would you like to talk a little bit about your personal experience?
Absolutely. Thank you, Dr. Span. First of all, on a professional level, I've spent the majority of my time as a professional working with underrepresented students from the Black and Latinx communities. And during this past spring, as students were trying to make decisions that would affect the rest of their lives in terms of where they would attend college for the next 4 years, the mental, the physical, the emotional, the financial tolls that it was taken on them made it almost impossible for them to focus on the tasks at hand. And many colleges and universities, including the University of Toledo, I've also worked at Bowling Green State University and the Ohio State University in Columbus as a part of my almost 20 years of experience. And it was really, really difficult to have conversations with students on the things that they need to be doing in March around financial aid, in April, in May, and June, and July, when some of them were having family members that were quarantined and struggling in their physical health with COVID. And some of them, parents were working many jobs and were losing jobs, and just they were losing the second half, the last third of their senior year. They were losing sports activities and club activities and relationships with their families and relationships with their friends. And here, it was time for them to make life-altering decisions. And so I experienced that this spring. It was really, really tough. And to Dr. Gregory's point, working with some of the majority population where, thinking that things are conspiracy theories or that things were all great when students were able to work, do their homework from home and do classwork from home. But the underrepresented populations and communities being hit the hardest, they might not have access to high-speed internet. They might have access to parents that were able to work alongside them. There's the language barriers that students were dealing with. And so I've experienced that on the professional level. On the personal level, I have had quite a few family members that were directly affected by the virus. And, Dr. Gregory, blessed and fortunate that no one has passed away from the virus. But on my in-law side, I've had a brother-in-law that got very, very sick that was in the hospital with COVID because he had experienced a heart attack earlier in February. I've had a niece-in-law that's a single mother of 2 daughters that was very, very sick from COVID. I've had both of my in-laws, mother and father-in-law, that were sick. They're retirement age and sequestered for over 21 days in their house on low income that have had to deal with COVID. On my side, I've had a sister-in-law that was experiencing difficulties from COVID. My sister, who's an RN and works in the health field, had COVID and had to stay in a hotel room away from her family for over 2 weeks. And so those are all things that have affected me on a very real level from the Latinx community.
Thank you so much, Gabe. Louis, would you mind giving us your
Yes, good evening. When this question was posed, I think the first thing that came to me in terms of a professional level was a sense of guilt, because being a professional person, I had the ability to remove myself and isolate myself when some of my family members were not able to because they were considered essential workers and were being exposed to the potential of contracting the virus. So I think those guilt feelings, and then compounded by personally dealing with my mother who has early to moderate dementia and having to be the primary caregiver, ensuring that her well-being was taken care of. And Latino families were very, like other people of color were extended families, very, very multi-generational. It was hard to have her be separated from some of my siblings and separated from the church, not able to go to church, so spirituality. So as a social worker, all these things go into my head in terms of how to continue to help her be in the present and be oriented. So that was difficult. As a professor, I earlier on this spring, the same issues that were mentioned about the students who didn't have access to internet and different things to help them deal with the COVID crisis. And my students are out in the clinical placement, so a lot of them got displaced And so trying to deal with that was a struggle and a challenge. I think probably one of the most saddest things in terms of the situation with COVID was, the first generation students who were going to graduate with their masters who couldn't have that rite of passage of being able to go through the ceremony and those type of things. So I think that was a big impact that was felt with the students. Professionally also, I think that with the Latino community, the language accessibility, not having bilingual providers to help educate them about COVID, the fact that they did not have insurance. And here in Fremont, where I live, it's primarily an agricultural community. So a lot of the migrant families that are put in housing that, they're very close together with not family members at times that are exposed, that could be potentially exposing each other to the virus. So, and having now that things are lifted, because there was some need for professionals in chemical dependency, when I went back into that, hearing the stories of the clients who relapsed because of the COVID sheltering in, that did not have access to support for the AA meetings were no longer going to be available face to face. So everything was virtual. So I think if you peel back things, it's really just a domino effect of this pandemic that has crossed all behavioral health and behavioral health. I think someone mentioned earlier I think it was Jerry, about this health disparities, even with the Black and Brown communities already. And then on top of this, if you go to the Ohio Department of Minority Health, you'll see lots of statistics about just disparities on diabetes and cardiovascular, et cetera. So the pandemic just compounded a lot of those issues. Thank you.
Thank you so much. Jason, Wanamaker, soon to be Dr. Wanamaker, are you give your experience here real quick?
Yeah, can you hear me okay?
Sound good, yes.
Okay, great. So I'm in my last year of medical school and seeing a lot of the healthcare and hospital changes happening firsthand. But what I think is most striking, and I imagine we'll talk about it tonight, is how COVID has amplified the spotlight on so many already existing socioeconomic disparities. So several panelists have already touched on it, and Gerald was listing some statistics. And we know it's not new information regarding wage gaps or financial circumstances, different lines of essential work being more vulnerable than others, access to healthcare, reliance on public transport, crowded living spaces. So all these things that make it difficult to impossible to quote unquote social distance or self-isolate when necessary. So the issues that are making it so that the Black and Brown communities are shouldering the load as far as COVID goes aren't new. It's just sort of making it a little bit more immediately dangerous in the past few months. So it's important that we're talking about it, but a lot of big changes need to be made so these vulnerable populations can be protected a little bit better.
Thank you so much, Jason. Dr. Holiday Goodman.
Hello, everybody. So nice to be here. I just want to mirror a lot of the comments that are already made. I know Dr. McKether in my bio talked about the fact that I've been a professor at the university for many years. I've actually taught at the University of Toledo now, I think about 32 years. And for over 20 years, my focus has been cultural competence, health disparities. And in the last few years, we've rolled in the social determinants of health. Some folks have talked about how some in our population may see what's going on right now as, not really relevant or not quite true. But I have to tell you, this time since January has been one of the most eye-opening times I have ever experienced while I have taught this material. I look at this period as a perfect storm of all of the issues that can come together to affect in a negative way Black and Brown health. So for my students who sometimes say, oh, well, it's only a few people, it doesn't make that much of a difference. Why do we have to learn this? I have many students that say, this should be an elective. Why do I need to know this? Let me look at something that's true or real. This topic and this era has been an eye-opener. So believe me, I think even those who were doubters cannot doubt now, because numbers don't lie. I actually tell my students that, people talk about statistics. I say, think about statistics as numbers with tiers, because every time you see something bad that has happened, it's not just one more person dead or one more person sick. It's some family member or that person crying and upset because of what's going on. So this is going to be something that is going to be challenging for me to go back in the fall and teach. I have to admit, I'm really going to have to prepare myself emotionally to go back and teach this content, because it's going to be difficult. This is the first time I have ever seen all of the issues, health disparities, social determinants of health, all of those things come together in such a way and in such a fast way. I don't have to go back to 1950 to show the data. I can show you data from yesterday that's related to this. So I'm hoping that this is an eye-opener for those of us who are teaching students such as Jason about the relevance of understanding the impact of health disparities and the relevance of understanding the impact of social determinants of health, because as Americans, our health outcomes are not equal. We may be in a society where we have access to all kinds of healthcare and remedies and solutions, but not every person has equal access to those things. So I think we need to make sure that we open our eyes to this truth. And as I have my students do as an assignment, look at ways that each respective health profession can help. What can pharmacists do? What can nurse practitioners do? What can physicians do? What can we do to move the needle? So this is something that is deeply, it's important, but it's just deeply personal to me, because, for the first time in my over 30-year career, have I ever seen these variables that I teach about come together in such a detrimental way.
No, thank you so much, Dr. Holiday Goldman. And I think that our other panelists did not make it on here, but I will. I'm going to ask a couple of questions. Please, if you're out there in the audience, please feel free to send your questions in the chat feature. The question will be reviewed by University of Toledo representative, and they will be sent to me either via text, or they'll be here, and I will be able to ask those questions. I think one of the reasons why I was asked to be the moderator for this is because I had COVID. I was one of the first people here at the university. I was the first person at the University of Toledo that they knew of that had COVID back in March 13th, right before we locked down campus. And I will tell you my experience. It was very emotional. I say that because no one knew what was going on at the time. I felt a little sick. So I isolated myself from my family and slept downstairs. I got up one morning at 3 a.m. to use the bathroom, and I walked out the bathroom and I collapsed. And that's something and one thing, anybody know me, I'm a control person, right? Whenever we're driving away with the family, I do all the driving. So losing that type of control was frightening. But what was more frightening was what happened after. I called the emergency room. I was told not to go to the emergency room. I reached out to a physician that I knew personally, who I traveled with and knew very well, and asked could I take the test, and I was denied the test. It was real scary because I couldn't figure out what was going on. I had my 2 young daughters and my wife in the house with me, and I had to isolate myself in the basement where I had to, and I'm not probably disclosing more information I need, but pissing in a bottle and bathing in the sink because of the fear of what this disease or this virus could do, and not knowing. it played more of an emotional toll on me as I look at the students. Since January, we've had about 3 students commit suicide, and 1 student talked a little bit about the situations on his Facebook post about COVID and how that happened, and how racism played a part. And I know Jason mentioned something earlier where you said how COVID is exposing the other social abnormalities that are going on in the world. And I want to highlight that, and I also want to get the panelists to speak to that. I know, Glenn, you have a slide that you want to share here in a minute, but I want us to kind of talk a little bit about that, because as people of color, we tend to, I tell a story. That's what I do all the time. So I'm from the country, the deep South, deep down in Albany, Georgia. And we used to have houses that sat on bricks. And these houses, we had wild dogs that run around. And in the country, if you're part of PETA, I apologize, but the way that we used to get rid of dogs back then is they would get ground beef and crush up a light bulb in it and cook it. The dog would eat the ground beef and then it would slowly die. But what the dog would do is go into a corner and sit there and die alone. And as Black and brown people, I know in our community we do that. We go off and we don't talk about it for what it is, for whatever reason, embarrassment or lack of knowledge. But as we don't talk about the disparities that are in anything. And this situation has highlighted a lot of abnormalities and things in that nature. And I would love for the panel to talk a little bit about that from any perspective that you guys can pick up on that. Too deep.
Dr. Fan, this is
Yes,
Gabe. I just want to talk about it from the perspective of isolation and being alone. I talked a lot about my family members that have suffered from COVID. And just to give a little more background about myself, I'm from rural Northwest Ohio, from a really small town called Leipzig. And my wife is also from the same small hometown. And we have very large families. And our families are both originally from the Rio Grande Valley in Texas. We come from grandparents that are migrant farm workers that eventually migrated to Northwest Ohio to work in the fields and got jobs in factories and settled. And so, we happen to be from the same hometown, got married. And so our families are very interconnected. When I say small town, about 2,200 people. And so we are very close to our families, and we do, and I'm probably not much different than many other Latinx families, but we do most things together. If we're not visiting one side of the family every weekend, it's the other side of the family. And the only time we don't do that is probably in the winter, January, February, when the weather's too bad because we have to drive country roads. And so for members of our families to be very, very sick with this virus, and to not be able to visit them in the hospital, to go to their homes and check up on them, to just be with them and encourage them in person. We didn't realize what that was like until it was happening. But as weeks went by and months went by and more people in our family were getting infected, and to hear the fear that was in their voices and to not to be able to do anything is an incredibly helpless feeling. And I also have on my other side, my grandmother is in a nursing home in my hometown, and my mom happens to be her primary caregiver. And I know for her it was very, very tough because she was used to visiting her nursing home almost every day, if not every day, every other day, and to not be able to see her, to be outside of a window and not have any human touch. I mean, all of those things were, as one panelist said, just a perfect storm of isolation and depression and, us just, I guess, realizing to not take for granted family and what a support system we offer each other, especially when our extended family is not even here and out of state in Texas. And so that just really brought it home to everyone where folks were saying, especially when we opened back up and people were starting to do things as if things were normal, and because maybe it hadn't affected their family or conspiracy theories or whatever it may be, You know, they were going doing all these things and inviting us. And it's like, no, we're not doing those things because although we are healthy, we know how it could affect our families, and we haven't even seen them in months. And we're not willing to put ourselves in jeopardy to then put them in jeopardy. Best believe I'm going to shelter in place. And talking about guilt, you know, both my wife and I are professionals, and so we were thankfully able to shelter home in place. But the guilt of not seeing them and seeing someone else. I mean, the first time we saw folks was in the month of June. I mean, that takes a toll. And so we were using, you know, phone calls and all these things just to try to connect and keep each other up, and calling every day, how are you, and checking on you, and bringing and delivering food and delivering medications, all those things. I mean, on top of trying to stay up on every other thing. Again, not asking for a pity party, but I just know that other people in communities of color are dealing with those very same things. And it just, as more and more people get infected, it just compounds and compounds on top of each other. And so that's how it just directly affected us, and I know many others in our community.
Right, especially coming from a culture that is very, I'm not gonna say very close. I mean, I've seen a lot of times, you know, you don't send your parents and grandparents to nursing home, they live with you in a lot of our cultures, and that is very difficult. One of the questions, Dr. Span, how, when you were impacted by COVID, how did you stay so positive? You know, my faith, I think I leaned on that a lot, but also knowing that I could not let my children see that, you know, this was something that was destroying me emotionally. And just also just having, you know, knowing that I had people out there that cared and I was living for it. It was being positive. I know one thing, I don't complain as much as anymore. You know, people previous to this kept saying, I wish things would be different. I wish things would change. Now everybody's saying, I wish everything was the way it was. Monica and Gwen, I'd like to ask you, could you talk a little bit about social determinants of health?
Sure. In the content that I teach, there are several determinants. We say that the social determinants of health, we simply mean those things that are conditions in which we grow, learn, work, basic surroundings. And these things are often shaped by multi-level distribution of money. So, you know, it's not something that's unilaterally available. It really is, you know, available to us in many different ways. So when I teach my students, I often tell them that, you know, we oftentimes learn how disease gets into the body. You know, we would learn about how we diagnose a certain condition, or we learn about infectious disease. But the social determinants of health, I tell them to visualize it in a manner of, how does society get into the body? Okay, because society can make us sick too. So we learn about those various types of things that can impact us. And there are probably about 5 major SDOH areas. And that is, do you mind if I just list them off? Do I have time for that? Yes. Is that okay? Okay. Neighborhood and built environment, health and health care, social and community context, education, and economic stability. Those are the traditional areas of social determinants of health. So when we think about economic stability, we're thinking about things such as poverty and housing instability. When we're thinking about education, of course, we're thinking about how education level is not unilaterally, you know, good across the border here. When we think about neighborhood and built environment, we're talking about things such as access to healthy foods even. And we've heard the word food desert and things like that. We're talking about safety and crime and various types of environmental conditions. And in regard to social and community context, we mean the various isms that are out there, the various discrimination areas, and even stuff like community support and social cohesion. So those are the types of things that are included in the social determinants of health. And the more of those types of things that we have access to, then the more likely we are to be healthy. So that is one of the reasons why we see such disparities in this particular COVID-19 crisis, is because if you don't have access to, you know, spacious housing, if you don't have access to healthy foods that can build up your immune system, if you don't have access to even things that are available in the language in which you speak, how in the world are you supposed to be able to combat this disease? So the deck is stacked against people who have inadequacies in those social determinants of health areas, simply because of the way the virus operates.
Thank you so much. Gwen, do you have anything you want to add or say something about locally, how things are doing with that?
Oh, just to kind of piggyback on Dr. Holliday Goodman's statements, because those are critical points that we need to keep in mind when factoring in the disparity and how it affects Black and Brown communities. People take for granted that there are those that have to take the bus everywhere that they go. So they can only go certain areas. If they go to a grocery store and their only means of transportation is taking the bus, they go to a grocery store. That grocery store is out of bathroom tissue. It's out of toilet paper, soap powder, paper towels. They can't take another bus to go to another grocery store and try to find things the way that those of us with reliable transportation can do so. That's a factor right there. A lot of people live in neighborhoods where the grocery store is far away, or they have to go to the corner store and get unnutritious foods. So those are big factors right there. Condensed housing, living in condensed housing. That's another factor right there. Spacing, distancing, not available in condensed housing. A lot of generations are living together. You have grandmother, mother, you may have 3 to 4 generations in one household. Those are other factors as well.
Thank you for that. And that's what I was talking about earlier when I said students, the ones we talk about. I have a student who has like 3 generations living in one household. And that's true. I mean, this young lady is a 3.4 GPA average, and she works 2 jobs, and that's even more risk. Now you got 2 jobs instead of 1 job, so it does take a lot of exposure on that. Thank you so much for sharing that.
You're welcome.
Louis, I have a question. What do you think the role of culture is in this pandemic?
I think that is very challenging in terms of folks who are really connected to their culture, the closeness, and for the Latino families, the familia is very important. Personalismo, which is the personal context. So a lot of these changes in terms of telehealth and those type of things are very not personal. And so there's a need to get acclimated to those things that makes it a little bit of a challenge. I think you have mentioned earlier spirituality, connectedness to your church, to the rest of the community. If you're isolated as a Latino and you go to Spanish Mass, that's the only place where you meet other folks that speak the same language, and now that's taken away. And of course, I mentioned earlier the fact that that social distancing and not having large crowds is an issue. So a lot of the quinceañeras and a lot of the celebrations, and I'm sure every culture has that in terms of things that they celebrate, are taken away. And all those things lead to even itself the illness, the being alone, not being able to have your last rites if you're Catholic, or not able to, have say goodbye to the dying person because it's all isolated. Those impact as you said, the mental health. People get depressed, and if they have a comorbidity of either a mental health issue or a substance abuse issue, that can get exacerbated, and then people relapse, or they start getting suicidal because of just feeling very despondent. So culture is the cultural things are important to us that provide us strength, and when they are threatened, that's when we're more susceptible. And some of the things that you met, and thank you for sharing that. I think that especially for men who are of color, the machismoism and those type of things may play a role in terms of, oh no, I'm okay, and then it's too late to do an intervention. And so, I do medical social work as well. And so it's interesting when I go into the families' homes, how they want to keep me there to talk because they don't have that interaction personally. And plus, when you're wearing a mask, that even makes it even more challenging. So, yeah, this has been a world turned upside down. And I think that the disparities we've already had those challenges with, diabetes, et cetera. You have people that, and we haven't talked, I mentioned this, but undocumented individuals who are not going to seek access to healthcare and services because they're afraid, because they're asking more questions now, even more so. So those communities are not coming forward and are not getting the interventions that they need, or just they're not educated on what they can see. Just in your situation, look at all the barriers that you bumped into when you were, and you're a PhD learned individual that's trying to access services. Can you imagine someone who has no education and doesn't speak English and is trying to get help? And that was, I think for me, that was the hardest part when I had to shelter in and not be that essential worker, that I couldn't be out there to be able to intervene and translate for folks that might need it, because at that time my priority was to not, put my mother at risk in terms of her health.
Thank you. Thank you for sharing. Hello? Okay, thank you for sharing that, Liz. I think I wanted to bring up the part about the undocumented students, because that was something that I've been running into as well. And even our international students, and this is probably, a lot of our international students don't have health insurance, and they either somehow told the university they had it and we had it documented that they have it, but they don't really have it. And I have students coming to me right now who won't say anything at all because they're afraid immigration or something like that will hurt them. So that's a huge population that goes along with our Black and brown people that we definitely know is sensitive as well. I want to ask this question to the panel, but Jason, if you want to jump in here, because you're kind of like uprising young professional. What are generational differences in viewing the COVID-19? Any of you can pick up if I need to clarify it, I can add more to it. But what are the generational differences in from your viewpoint in viewing COVID-19?
Yeah, so I'm sure my perspective might be a little different to, the whole population that's my age, just because I'm interested in the healthcare field and will be pursuing a career there. So I think I've been paying a little bit more attention, but I have to imagine that people that aren't so interested kind of have an invincibility complex about it, that are closer to my age, just because we're less likely to probably have the compounding circumstances and health conditions that might make someone more at risk. I've been trying to keep track too, and I know that it is affecting people that are around my age and sometimes without any coexisting health conditions. But I think it's unfortunately bringing to light the selfishness that can come with being in your 20s and maybe not social distancing or wearing your mask or kind of staying inside like we should be to protect the more vulnerable populations that still need to be out in the world. So that's been unfortunate to see. But hopefully with more knowledge, we'll be able to do more with that.
Okay. Thank you so much. Anybody else wanted to kind of chime in on the generational differences of COVID-19?
I'd like to say there is an age range, and I don't want to just stereotype a specific age group, but what I've noticed in those that are in their later 20s to mid 30s, there's a huge mistrust. And there's been an adopted rumor of a conspiracy theory that COVID is not real and the numbers on the news are not correct, and hospitals are getting reimbursed for more diagnoses of COVID that are not true. There's a huge mistrust amongst a lot of people in various age groups, but I'm seeing it a lot in my arena with that age group specifically. And what I do is I speak to my own personal experience with COVID. As I previously stated, someone very near and dear to me passed away from COVID, and they went in 3 days. They passed away in 3 days, and they weren't old. They didn't have any comorbidities, any other existing medical conditions. They went in 3 days. So I can tell people with all certainty that COVID is real. It's not a conspiracy. It's a real diagnosis. It's a real disease, and it's really fatal. But for some reason, there's a lot of mistrust out here in the community, in our community, in the African American community. They don't really trust what's being taught, what's being spoken on the news. They don't trust it.
I mean, it could be a Tuskegee experiment. It could be, we can name the list of things that maybe
Yeah.
is the case. But you know, even our parents, right? You know, they'll go pull some turpentine off a tree and make a cure in a heartbeat before going to the doctor and talking about that as well. When can I ask you to can you talk a little bit about the local numbers here? I think we have a slide up here. Are you ready to do that, or you wanna?
Yeah, go right ahead. Go right ahead. Let's
Can
see
you-
the slide here. I'm glad that you were able to receive that because it's up to date as of 2:30 today, these numbers here. The yellow is African Americans, the green is Caucasians. There's a great percentage that is other, so there's other nationalities aside from Caucasian and African Americans. And then the blue is unreported. What you see here, Lucas County population as a race is a little over 74% white. It is 92.70% as far as ethnicity and population, not Hispanic or Hispanic. Black, 20+%, and other, a little over 5%. Hispanic, Latino, 7.3%. Now you go down to the pie charts. For Blacks, and this is cases, so there are 1,043 cases in Lucas County that are African American, 1,043 that are us. There are 1,014 that are white. There are 1,082 that are unreported. And then there's a little over 5.5% of other nationalities. Now go over to the deaths. The deaths here, look at the deaths.
That's all fatal?
Yeah. Yeah, look at the deaths. And so it was broken down. This is as of 2:30 p.m. today. This is the data as of 2:30 p.m. today, which it changes every minute. So tomorrow, this pie chart could look totally different.
Wow.
So you can see the disparities. You can see, as we spoke before, there's many reasons that are due, that are the causes of these disparities. There are many reasons that are the cause. Some cannot be prevented, but some can. Let's be quite frank here. There's disparities in treatment with minorities, not just African Americans, Latino as well. Minorities, there's a disparity in treatment. When approached at some healthcare facilities with some health professionals, they're treated differently. I read an article, recent article, where Serena Williams and Beyonce spoke on the disparities that they encountered when they were pregnant. Has anyone else read that article? Serena Williams can certainly, and Beyonce, they can certainly pay their bills. But Serena Williams had to very aggressively go to her doctor and demand to have an ultrasound. She was brushed off. Her leg pain was brushed off as the weight of the baby, causing the leg pain. Well, if she had not been persistent, she had bilateral DVTs, blood clots. And this is Serena Williams. So it's not about income there. Why did she have to fight so hard to get an ultrasound? She certainly could pay for it. She probably could have bought the hospital. But had she not been persistent, those blood clots could have broke loose, turned into an embolism, and turned out fatal for her. Beyonce had a lot of respiratory problems that she spoke on, and she had to press and press and press to get treatment. So there's disparities out there that can be controlled, and there's disparities out there that cannot.
No, it is. And I said earlier, about my experience. I know my wife, she lost, thank God nothing have shown in my family. They all got tested. My wife lost her sense of smell. And she lost, it was two things that she lost that were on that list. And the doctor told her not to come in. They wouldn't test her. She just got tested like 3 weeks ago. Now, another colleague of mine who worked at the institution who was of other persuasion, a white female, she had one. She got a chance to go through the drive-through at Rite Aid the very next day, and one of my staff members also got to do that. And so, you don't want to say, you don't want to point at it because we're tired of it. We're battle fatigued by calling things out. But if we don't, this is the wrong time not to do that, because there's so many things, as Jason said earlier, that is exposing all these other elements of things that are going on.
Correct.
That's pretty powerful. Thank you for sharing that.
Sure.
Well, now here's the question for everyone. How do we begin addressing the disparities?
Would you repeat that, please?
How do we, how do we start addressing these disparities that you've spoken about?
Well, you began to answer that. We need to call it out when they occur. We need to speak up. Either we're part of the solution or we're part of the problem. And we need to speak up. We need to address. We need to hold people accountable that we have to hold accountable and stop this process that's been going on for centuries. And it's not going to happen if you want to put your head in the sand. It's not going to happen.
Can I add to that, Sammy?
Please.
I know that the social unrest that we've been experiencing at the same time related to the murder of George Floyd has brought to light a lot of the disparities in general, not only health disparities, but the disparities in general that African Americans and other people of color are facing. So that also, the coronavirus, I said, was a perfect storm of health-related issues, but that social phenomena that we're experiencing now in regard to the civil unrest that we are seeing has brought attention to disparities in many ways. So I think we have the country's attention. So now when we say things are not equal, they cannot deny it. Before, when we were saying, oh boy, this coronavirus is really affecting Black and brown people, it's like, oh boy, too bad, and I don't mean to be crass, I'm sorry. But that's almost how I felt that it was being treated. But now, especially since we've had the issue with George Floyd, it seems as though we have more and more people that are realizing that, hey, this is really the truth. There are disparities in health, there are disparities in housing, there are disparities in banking, there are disparities in policing, there are disparities in just about everything, every area of life that has unveiled the systematic racism under which we live. So I think that all of these factors coming together, now that we have the country's and probably the world's attention, is the time for us to get to work to come up with solutions to remedy some of these things. You say you support, the cause, put your money where your mouth is. Let's go and do some things that can help to eliminate these disparities that we know, those of us who have been teaching and living and working in this, have existed for years and years and years. This is not new to anybody on this panel. But since it is relatively novel to some other people, many people in power and authority and have the ability to do some things, let's try to keep pushing until we see some changes made. That's what I say. The time is right. If we miss this opportunity, we have done ourselves a big disservice.
Thank you so much. And I agree, a saying that I like to say a lot, speak the truth, anticipate discomfort, and find a resolution. And, Dr. Cecilia used to always say, if there's a good fight, don't be afraid to get into it. And this is going to be a tough road. I mean, as I sit here and talk to the panel and all of you all kind of fit in the same category, being in the Black and brown category, although this is not representation of what this campus or this community is. and we have to know that. We have to make sure that we kind of continue to support each other as we start calling these issues out. And we have our white colleagues as well, but we do have to start calling these out. To your point, Gwen, about holiday. I got a question here. What is the university doing to keep students safe when they come back in a few weeks? I think Valerie Ralston is on the call who can answer that. Willie, can you unmute her?
Yeah, so good to have to ask Brent. If he
Brent.
I apologize. Who?
Valerie Ralston.
Yes, go ahead. Sorry about that.
All right.
Hi, good evening, everyone. Can you hear me okay?
You sound perfect.
Great. So the university has multiple task force and committees set up to really make sure that we are preparing accordingly for our students to come back, particularly in the residence halls. We have decreased our quad rooms, decreased our triples, so now we only have doubles. We have to, of course, respect social distancing. We have increased our number of single rooms in the residence halls. We are working hand in hand with our housekeepers, custodians, I should say, to support a, multiple time per day cleaning regimen, disinfectant, all of that. There's conversations now, even with students talking to their advisors about, definitely having more online classes than in-person classes. We've had some conversations with our new vendor, our new dining vendor, about just ways that we can support students being able to eat on campus, but also respect social distance and, more individually packed food for the students to eat. There's just been, a wealth of work being done, specifically, even the check-in process itself. In residence life and housing, we have coordinated a low-touch, no-touch check-in process so that students and parents will have very little contact with team members when they move on to campus. Our director of the rec center has, of course, put all kinds of safety equipment up, plexiglass, so the students can still maintain their wellness physically, but still, work out in the rec center. They installed things like sneeze shields in the rec center. Lots of work, furniture being blocked off in the student union. Just a lot of focus on places on campus where there's large congregates of students to support social distancing. And the last thing I'll say is this face covering mandate. There have been so many conversations, Dr. Span knows, there's been so much conversation about how we are going to mandate our students to wear these face coverings. Our office has purchased COVID-19 prep kits for students. Dr. Span's office has them on hand, but we really need everybody's help engaging students in the conversation just to ensure that they support our efforts on campus with encouraging them to wear their mask and be socially distant and kind of restrict some of their movement while they're here on campus.
All right, Valerie, I wonder a follow-up question. I know we got quite a few students and staff on here. If a student gets COVID-19, what will be the protocol?
So I'm glad you asked about if a student gets COVID-19, but I'm going to back up a little bit. I was just on a call earlier today as discussions are being had about what we are doing to test students. So in the abundance of transparency, there are still a shortage of tests, but I need this group to know that we are in conversations about how to structurally test our students on campus, test our residential students, test our athletes. And if a student comes back either positive or if that student has been exposed, if it's a residential student, we do isolate those students in isolation, quarantine housing. The designated space for isolation and quarantine is going to be Carter Hall. But until such time that Carter Hall is complete and ready to welcome students, we've negotiated a rate with the Radisson on the health science campus to house our students who are impacted by COVID-19. while they are in isolation. We are, of course, ensuring that food is delivered to them. And some of our partners on the health science campus are standing up the telemed so students can talk to a health professional by phone.
All right. Thank you so much. And we are working with the health department, right?
The health department, CDC guidelines, everything we do, we send through our incident command team. So all of the things that we're due, certainly we are aligning ourselves with the health department and the CDC.
Thank you so much. So one of the things, and I don't need really, maybe you can answer this. Right now, they're working on students coming back, and there is going to be a requirement that everyone wears a mask. We're still in the process of figuring this portion out. But when students come to class without a mask, right? My concern is faculty members or even staff members who see a student without a mask on, they ask the student to put it on. The student might not have one or choose not to put one on. What will that faculty or staff member do? And for our Black and brown students, we know that those choices are critical because it could be anything from calling the dean of student's office or calling the campus police. And in this climate with everything going on, calling the campus police it won't be a good image. And it can just definitely stir some things up as well. So I know your team is working on that on incident command. Valerie, I'm on that team with you, but those some things that still kind of concern me as we move forward. Do we have any last thoughts or anything I know we only got like a few minutes left for this for the panelists. I really appreciate you all coming on, but Gwen, you get ready to say something?
Go ahead. I'll wait until you're done.
Nope, I was just turning it over to the panelists to kind of give some final thoughts, or even suggestions or thoughts or questions if you all may have.
I think it's really important for everyone, not just the panelists, for everyone to try and gain the trust of the community. And that's going to take a lot. We're not going to win everyone, but for the most part, if we gain the trust, then they will comply with the regulations and guidelines associated in slowing down and hopefully stopping this spread. But you have to get that trust out there. And that's, people have been wounded. For various reasons, they've been wounded. And what I see is a huge lack of trust. And that's why people don't feel that they need to wear a mask. People don't feel that they need to protect themselves and others. And the bottom line, when you go back to the root cause of the problem, it's a lack of trust. They don't trust what our governor is saying. They don't trust what we're telling people. You should hear some of the calls that we get at the health department where people think that we have just made this up and there's some kind of money in it for doctors and coroners and the healthcare facilities, that they're getting a kickback, a financial kickback, if they write the diagnosis of COVID on someone and it's actually bronchitis or it's actually pneumonia. So I think that's just worth mentioning before we end, is to think about ways that we can gain the trust to our community to try to help prevent the spread, to try to help to slow down the spread. They have to trust us in order to believe us. If they don't trust us, we can talk until we're blue in the face. They're not going to believe us, and they're not going to do what we're asking them to do.
Thank you so much.
I agree with that. I think engaging with the students from the very beginning, maybe if at the first class, the instructor can set the tone to create a teaming environment, that we're here, educate, and try to get them to be part of the team versus, taking it from and I guess I'm a social worker, so those are the type of approaches to try to have that alliance, like I do with clients. I develop a therapeutic alliance with them so that they can motivate themselves to make changes in their healthcare, et cetera. That's what I think the same approach that I would take with my students is to say, look, this is the world we're in right now and how it relates to the profession of social work, and what do we need to do to model change, and how, as social workers, how we can do that. And that can be done in any class. If the instructor just takes those few minutes to approach that, so that it becomes not an antagonistic power and control thing, that it becomes one of partnership, as Dr. Gwen had mentioned.
Thank you so much. Dr. Holiday, good. Anybody else wanted to make some last statements here before we take off?
I just agree with everything everyone has said. I think it's going to just take a collaboration across the board. And I think I'm really glad that, the focus here is on the Black and Brown population. I look forward to working, with more of my Brown brothers and sisters and, Black brothers and sisters, and to how can we not let this momentum stop? We have got to be responsible to make sure that people understand what we are experiencing, and that those folks who are able to help to do something about it, we want to be able to hold them accountable as well. So I just hope that this is an opportunity. If there's any students on the line, especially healthcare students, this is your fight also. We want to make sure that every patient, regardless of background, has the best possible outcome. And unless we start to address some of these health disparities related to care, then every patient just will not be able to, get the level of care that they deserve. Thank you.
Thank you so much, Dr. Holly. Anyone else before I kind of say my closing remark? Well, since no hand is raised, I just want to say thank you all so much. I think we have a panel, and I want to kind of say thank you from many levels. On a professional level, for coming here with the wealth of knowledge and experience that you all have, but on a personal level, because we don't get into this type of circle that much and talk and get to see each other. I know we talk a lot about helping our Black and Brown students and community members, but also we have to talk about us. And one thing I noticed about looking at us, and even I sit here looking at this panel, you all carry on your shoulders and on your face the burden of carrying so much. You all have job descriptions, but you also have that unwritten job description that takes 90% of your job. And that is looking at people that look like you and trying to help them get through the system. To Gwen's point of that lack of trust, to help them build that trust so they know what needs to be done. So I want to say some parting words as far as, yes, let's take care of the masses, but let's take care of ourselves as well and make sure we reach out and help each other out in the front. I'm very thankful that Dr. McKether asked me to moderate this. I wanted to talk less so I could hear all the wonderful words and insights that came from you all. Students, if you have any questions, please feel free to reach out to Dr. McKether's office, even my office. We'll get you the answer that you want. If any of you want any contact with any of these individuals, I'm sure they will take that unwritten job description to heart and support you in any way that they can. God bless you all. And thank you so much. Thank you.
Good night, everyone.
Good night.
Great job, Dr.
Thank you.
Everybody.
Okay, dude, I'm so sorry.